Hello friends, this is Kim Miller with Inspired Hygiene and welcome to February. It's Heart Health Month. That's right. This is our opportunity, as it is every day, to remind our patients how important their blood pressure is. So please let me encourage you, take your patient's blood pressure at every recall visit, at every perio maintenance visit, and if you're doing an injection, especially if you're giving them an injection during periotherapy, be sure you're taking their blood pressure at that time as well. Here's a myth that some of our patients present to us that, oh, I'm on blood pressure medication, so if their blood pressure is skewing high, they think it's acceptable for it to be that way because they're on blood pressure medication. Well, here's a tip. Now, this is personal experience. I had this happen with my father. His blood pressure was skewing very high, and he said, well, I'm on blood pressure medication, so everything is fine. Well, in fact, everything was not fine. I encouraged him to go back and see his doctor, and sure enough, he needed to change his blood pressure medication because the one he was on was not working. So let me encourage you that if your patient says to you, well, my blood pressure runs that high, even though they're on blood pressure medication, please get them back in to see their physician. A blood pressure medication should bring the blood pressure down to 120/80 or less, which is considered the normal range. In fact, you might remember that in November of 2017, the American Heart Association issued some new guidelines to us, and I've included those guidelines for you here. So just as a reminder and an encouragement, please take the 60 seconds that it takes to take your blood pressure, to take your patient's blood pressure. It in fact could save some lives. And after all, that's what February Heart Health Month is all about.